Before we start our treatment, we're going to apply our conductive gel. When applying conductive gel, use a generous amount. I use 9 pumps. Now make sure you really coat the skin all the way up to the lash line, all the way out to the ear line, down the neck, down the throat, all the way down here, all the way up to the hairline. And it's important in areas where your skin is thin, like the forehead and the eye area, that you get a good coating on there so that you don't drop the current. It's okay if you get it on the lips. You should be coated like this. Whatever's left, I usually just rub into my arms, and then I wash my hands so that it's not slippery when I'm doing my treatment. Let's begin. So this treatment is the same the whole way through. So if you want to kind of freeform here, you can, although I recommend that you follow my routine because I'm working with the lymphatic pathways and it'll give you the best result. Also, remember, if you feel like you're getting behind me, you're not feeling the vibrations, pause the video and reapply conductive gel. And also remember, you need to apply a good amount of pressure. This is nanocurrent through and through, so there will be no sensation at all. You'll have to keep looking to see that the lights are on and feeling for your vibrations that come every 10 seconds. Let's start. So you're gonna turn your zip on. You should hear 1 beep. If you heard 2, you just turned your zip off. Go ahead and hit the button and you'll hear the 1 beep, which means it's on. It's not gonna start, as I said, until you set it down to the skin, and then you'll see those lights come on. And now we're moving up the back of the neck and we're gonna hold right under the earlobe. I just felt a vibration, now I'm gonna do it again. Same exact spot. The vibration comes about every 10 seconds. And we're holding here. Okay, now we're moving to the mid-neck. And we're moving up to under the jaw and holding for the vibration. Good amount of pressure. I can see my lights are on. And I'm holding. We do each area twice on the neck. Okay, good. Now we're going to turn our device vertical and go up the side of the throat and get right under that chin and hold on the double chin. Okay, when you feel the vibration, do that again for your second time. And wait for the vibration. Okay, now we're going to turn it vertical and we're going to carve out the jawline and move the zip out in front of the ear. Okay, starting back in the middle of the chin, your probes are hugging the jawline basically. They're on each side of the jaw. And let's do it a third time. Moving out in front of the ear. Okay, now next we're going right here under the cheekbone. And we're moving out so that our top probe is at the top of the ear when we're holding, waiting for the vibration. All right, let's do that again. I'm looking to see that my lights are on. I know I'm conducting electricity. Okay, let's go for our third time. Okay, now we're gonna go over the lip. So on the upper lip, we're just swooping back and forth. You're gonna have to count 3 vibrations here. Now, if there's one spot that really bugs you, you can kind of hover. Or if there's lots, you can do back and forth like I am. All right, now next we're moving to the nasal labial fold right here. And then we're gonna move up so the cheekbone's in between the probes, and then we're gonna pull up, up, up. Again, over the nasal labial folds. You want your cheek in the middle. A lot of sensitive skin types have broken capillaries here, so we want that in the middle of the probes. And the third time. All right, now we're gonna move under the eye. So turn your device horizontal and you'll see the light come on. And now we're just gonna swing slowly back and forth for 3 vibrations. So you have to count them again. There was 1 for me. They come up every 10 seconds. And you're looking for that light to be on. All right, I'm almost to 3. All right, now we're gonna turn it vertical and we're gonna put the probe right on under the tear duct and we're gonna pull out. Out, out, out over the crow's feet. Okay, now back down under the tear duct. And that upper probe is right under the lash line and pulling out. Okay, and our third time. And pulling out, out, out. All right, now we're gonna work on the forehead. So you have to use a good amount of pressure here. We're starting on the tail of the brow. Push down, you'll see the light come on, and you're gonna fishtail up, 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 up into the hairline. We're gonna do this 3 times. If you don't feel the vibration here, then you're gonna wanna pause and apply more conductive gel treatment. Okay, next we're gonna be moving right over the peak of the brow, right here. And we're moving up, 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 back and forth till we feel that vibration. Okay, next we're going to be moving to the start of the brow. As soon as we feel that vibration, you're going to see that the light's on, and you're just going to slowly move up. To the hairline. One more time. Okay, next we're moving to the 11s. So you're gonna push down, you'll see that light come on. And we're gonna move back and forth and move right up to the hairline. If you only have 11s you're concerned with, you can linger over this area and just sort of fish back and forth right here. Okay. For my third time. Now, you just heard that beep. That means we're halfway through the treatment. So we're gonna do the exact same thing on the other side. Okay, so we're gonna start in the same area on this side, using a good amount of pressure, looking for the light, coming up the back of the neck, behind the ear and holding. Waiting for the vibration. Now we're doing the same exact thing. And waiting for the vibration, holding right here. Next, we're moving to this mid area of the neck. And we're moving up these lines, and we're gonna hold right under the jawline. And we're gonna do that again. Holding right under the mid jawline. Okay, next we're going vertical up the throat and get right under the chin. You can see the lights are on. I know it's conducting. I'm holding here. And now I'm going to do that one more time. We do each location on the neck twice and everything on the face 3 times. Okay, so now we're going to turn it vertical. And again, we're going to carve out that jawline and pull that zip right in front of the ear. And now starting in the middle of the chin, and you can see your jaws going. It's in between the 2 probes. The 2 probes are hugging the jawline, so to speak. All right, and now my 3rd time. I can see my lights are on. It's vibrating every 10 seconds. Perfect. Now we're moving to this area. So you're going to get right under that cheekbone and kind of make like a little swoosh. And your top probe should be on the top of your ear. Okay. Again, you're avoiding this actual cheek area. So a lot of sensitive skin types have a lot of broken capillaries in this area. So you're just going right under that, and your top probe is resting right on the top of your ear. Okay, next we're going to the upper lip, and we're just bouncing back and forth for 3 vibrations. So you need to count as you feel them. You don't want to lift it off your skin, just keep contact. Okay, good. Now next we're moving to the nasolabial fold right here. And then again, the probes are going on this side of the cheekbone and we're pulling up. Back over the nasolabial fold. And then my probes are going on the sides of my cheekbone and up. And last time. Okay, and up. Now next we're going to move under the eye. So get your zip horizontal, put it right under your eye, right up to the lash line. And just very slowly move back and forth. Count for 3 vibrations. There was 1 for me. You should also see the light. All right, now we're going to turn it vertical. And we're going to start right under the tear duct, and we're going to carve up and out over the crow's feet. Okay, back to the tear duct. And we're just making sure our lights are on, and we know our lights are on also when it's vibrating. All right, last time. All right, now we're going to move to the outer brow right here, the tail of the brow. Get right under it. And if you're moving side to side like this, you're moving up up, up, kind of over these forehead lines. When you feel the vibration, do it again. We're going to do each location 3 times. If you're not feeling those vibrations coming, pause and add more conductive gel treatment. And then hit play and just start right back up. Okay, next we're moving right over the pupil. I see the light come on, and now I'm fishing back and forth over those lines and moving up, up, up. There was my vibration. I'm doing it again. The fishing helps it move, helps you keep contact. There's the second time. One more time. All right, so now we're going to do the start of the brow. So you almost start diagonal. You'll see the light come on, and then you're going to pull up, 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 up. Okay. Now, if your skin is very thin, you don't need to get too far up here. You can kind of stay on these lines where there's a little bit more meat. You'll get better conductivity that way. And last time. So last, we're moving to the 11s right here. So you're just gonna press down till you see the light, and then you're just moving over those 11s, and then slowly up till you feel the vibration. Now, if you only are concerned with the 11s, you can just hover here. But I care about other things, so I'm moving up, waiting for the vibration. And last time. Okay. When you finish, you want to wipe your zip down with something soft, like gauze, or like your microfiber towelette that we give you with your zip kit. You can also spray it in rubbing alcohol to sanitize it. Get it nice and clean. And then put it back inside of its little travel pouch and seal it up for safekeeping.